Rosie here at Just Chill Baby Sleep. Today I'm talking about infant reflux. I'm asked a lot about this, and I know a lot of you out there struggle with babies who are uncomfortable and have reflux, so hopefully this will help you. First of all, let's talk about what is reflux. Reflux is regurgitation of stomach acid. So there's a valve at the bottom of our tummies, and in little babies it can be immature, so sometimes that valve doesn't hold all of the stomach acid in the stomach. That's why, in theory, as they grow out of reflux because the valve is able to hold the acid down. So what can happen sometimes is this acid rises up the esophagus. Sometimes it will sit in the throat, which is what we call silent reflux, and sometimes they're sick, and that is normal, ordinary reflux. So an amount of reflux is kind of normal for babies, and that's what we call positing. That's where small amounts of food or their milk come up. If you think about it, if you've just had a big meal, you lay straight down and you need to burp, the chances are some of your food might come into your throat. So if you think of it in that sense, it's quite normal. What's not normal is when baby's life is really, really disrupted. Potentially they're not feeding effectively, they're not gaining weight, they're incredibly unhappy all the time, and these are the things we're going to be looking at. So symptoms of reflux. How do you know your baby's got reflux? Well, normally it's a combination of a number of symptoms which will tell you that your baby might have reflux. Number one, being really fussy on the bottle or the breast. So on, off, almost like a woodpecker. Sometimes they can actually develop a feeding aversion, so they associate that feed with pain, so they don't want to feed, and that's when they might be losing weight, and that's when you absolutely need a medical professional to help you. They might do a lot of swallowing and gulping after feeds, where they're trying to kind of soothe their own throats, generally seeming very unsettled. They can have sweaty hands, and that's quite an indicator where the adrenaline in their body has risen because they're in pain, and a symptom of that can be sweaty hands. They can just seem really, really wired, like they can seem wide awake because they're in pain, and that's another symptom. Obviously being sick, or being very, almost always, the number one symptom will be being very unhappy when they're laid down because the acid is pouring into the throat, and that's when they're in pain. They're sometimes in pain and unhappy when they're in a car seat, because if you think about the position, they're kind of like this, so it pushes the acid up into the throat. Saying that, bear in mind, a lot of babies don't like car seats. Doesn't always mean they've got reflux, but it can just be a combination of these things telling you they might have reflux. So what can you do if you think your baby's got reflux? If you think they have a serious case, obviously you get help from your GP, your health visitor, or someone else, a friend or family. If you're really struggling, always ask for help. Practical tips. Keeping them upright after feeds. This is number one tip. I'd be looking for around 30 minutes after feeds. You can hold them on your shoulder, nice and close to you, so that they feel relaxed and comforted, and let them come round after that feed. Let that feed settle in their tummies before you put them down. Best friends for a new parent with a new baby is a sling, right? If they've got reflux, do their naps in the sling, that's fine. It's better that they get the sleep that they need and they're comfortable than you get obsessed with putting them down in their cot, because a small baby, especially with reflux, is going to struggle to do that. And we should always put babies to sleep on their back. So sling sleeps are great. If you are putting them in their cot at night, obviously, then a wedge can help. So you need to get a specifically designed reflux wedge, so it's safe and it's secure across the cot or the bassinet or whatever they're sleeping in. And it just means they're at a slight incline, so they're not completely flat. Therefore, the acid isn't pouring straight into their throat as it might have been. Another thing they do when they're feeding is potentially they might be like arching their back and really unhappy, in which case have a look at how they are feeding. If you're breastfeeding, get someone to check your latch. Sometimes if they have a really shallow latch, they're not latching properly, they're taking down lots of air, and that can exacerbate it or cause it. If you're bottle feeding, look at the teat, make sure there's not loads of air in the teat. When you're making up the feed, make sure that it's not full of bubbles. So don't shake the bottle, swill it like a drink. when you're making up the feed with the hot water, because we don't want loads of air. That can cause it. If you think about it, if lots of air is going down, that air needs to come up again, and they can bring the acid with it, so that can exacerbate it. So get your latch checked, get how you're feeding them checked, check the bottle, make sure the teat size is appropriate to your baby as well. That's really, really important. Make sure baby's comfortable. So sometimes reflux can be exacerbated by tight clothes. So don't put them in like really tight baby jeans with a tight waistband. That's going to potentially compress the tummy and make it worse. Don't do what we're tempted to do, which is overfeed. So sometimes if we've made up a bottle, or if we've expressed breast milk, like a whole bottle's worth, and they don't finish it, it can be tempting to just try and get them to take that little bit more. That can cause their stomach to be too full, and they're more likely to regurgitate. If you think about it, if you keep eating and eating and eating a massive meal more than you actually need, you can feel uncomfortable, and it can feel like that food is in your throat. So feeding little and often can really, really help. And don't worry about it. You can get into a routine later on. You can always get baby sleeping in their cot later on, but we're talking about babies that are really uncomfortable, and it's far better to have them comfortable and rested rather than being in a strict routine in a cot, sleeping independently. They can still sleep independently in theory, and that's what you'll be working towards, but number one is we want baby to be comfortable. If you're breastfeeding, don't give up breastfeeding because you think that giving them formula will stop the reflux, because it's very, very unlikely that that's the cause of the reflux. It will be something else causing it. So if you're unsure, get some support from a breastfeeding support worker or a lactation consultant, and they can give you some really good solid advice. Always ask for help. Follow your intuition. If you think there's something wrong with your baby, there might be. We are often correct when we're starting to think about our intuition. Sometimes your baby might be presenting with reflux symptoms, but it's actually an allergy. One of the common allergies is cow's milk protein allergy. If you have a history of allergies in your family, your baby's more likely to have one. Doesn't mean they will, and nothing's for sure, but it's worth investigating. We don't want breastfeeding mums to be cutting out dairy completely from their diet and cutting out a food group if they don't need to, but if there's good evidence to suggest it could be that, then it's worth trying it. Again, you can do that under the advice of your GP or your paediatrician. The other thing people talk about a lot with reflux is early weaning onto solids. Only do this, again, under the advice of a doctor. If you are doing early weaning, make sure you're not doing it before 18 weeks, and you should make sure that baby is actually ready to eat. So normally it's around the 6-month mark. It could be that some babies are ready for a tiny bit earlier, but you need to be looking at whether they have enough head control, whether they're interested in food, and whether they have the tongue thrust still present. So that means when they push things out of their mouth. So if you put food in, then none of it goes down, and that's when they're not really ready to start eating. But again, if you're unsure, speak to a doctor. If it's a severe case of reflux, your doctor might talk to you about medications which can help reduce the stomach acid in the stomach. It won't stop them regurgitating and being sick, but it will stop it being uncomfortable. Medication should only be used if you're sure that it's going to be beneficial. So always ask the question, what would happen if we didn't medicate? What else can we do first? And if we do medicate, what's the plan for this medication? When are we going to reassess it? No one wants their baby on medication long term unless they absolutely need it, because every medicine potentially has a side effect. So you need to make sure you've got a plan in place for what you're going to do going forward. Lots of them do grow out of it by about 12 months. So if you are still struggling and you've got an older baby, you should definitely seek some help and hopefully have a good plan in place for reflux management. Also, I just wanted to say there is a really good charity with lots of information and lots of support. They are called livingwithreflux.org. If you have a look on their website, there are support groups they can point you to and other really good resources. Don't ever feel like you're on your own. You are not the only one with a baby with reflux, I promise you. It can be really traumatic. There can be a lot of crying. But using my tips, hopefully, that might be helpful. And as I said, always, always ask for help if you're struggling. Bye for now, guys.